I was walking along a trail when I stepped on a big snake and it's eaten me. I've got 2 puncture marks.
Okay, and where have you been bitten?
On the ankle.
The woman was out exercising on a bush track in Hepburn Springs, 100 kilometres northwest of Melbourne.
Thames 5, cleared for takeoff.
We are all set back, doors at 4 o'clock.
Flight paramedic Matt is now on the way from the Essendon Air Base.
Ground snakes are one of the most venomous snakes in the world. Once the venom gets into your bloodstream and is transported throughout the rest of your body, it affects your breathing, it affects your muscles, but it also affects your blood's ability to clot, so people can start to bleed an awful lot. So we need to attend to snake bite patients very quickly.
Thames 5, we're airborne out of Essendon, on our way to Hepburn Springs.
How are you feeling? Does the limb feel like it's swelling at all?
I think it's starting to swell up. It feels like it's getting tight. I just feel a bit sick. Just panicky, that's all.
All right, just be still and wait for help. I'll stay on the phone with you all the way.
Yep.
I'll need to sort the backpack with a few drugs and then I'll just take some analgesia down, some adrenaline, some bandages.
It's steep country through there. Pretty thick bush, isn't it? Yeah, mate.
A local paramedic team has now hiked through the difficult terrain and reached the snakebite victim.
Matt from Thames 5, are you with the patient there?
Yes, we are.
Blood pressure-wise and everything, heart rate and so forth, how's that going?
We're just doing that now. She's had 1 vomit.
Yep.
Blood pressure 136 on 8.2.
Yep.
The woman appears stable for now, but her body could start shutting down at any time.
If this patient doesn't get medical attention soon and the venom is transported throughout the rest of her body, she could die.
Okay, they should be in this area here at 3 o'clock now. Can you see the ambos on the ground there?
I see that, yep, I see the scene, mate.
Thames 5, we're overhead at scene at the moment. What's the likelihood of getting them out?
It's very unsafe for us to walk around. You're bouncing around a lot.
How long would it take to walk around?
45 minutes to an hour, probably.
So the crew on the ground are informing us that it's going to take them a long time to get the patient out over unsteady ground. And the concern with that is after you've been bitten by a snake, you want to try and stop the venom moving around the body. So you want to keep the patient nice and still as much as you can.
Ideally, you would winch her out.
If there's no other option, then we can do it, but it is a last resort, mate.
Right door is coming back.
Just stay on the track, Trev.
In country Victoria, flight paramedic Matt and crewman Trevor are on an urgent mission to rescue a snakebite victim stranded hundreds of metres away on a bush track. The 31-year-old woman was out jogging by herself when she was bitten by a deadly brown snake. For now, her condition is stable, but she could quickly crash if the poison starts spreading through her system.
Step down through here.
G'day, how you going? I'm Matt.
G'day, Matt, I'm Ree.
Ree, what do you do for a job?
I'm an ambo.
I thought I recognised you. So you know exactly what's going on?
She's taken a couple of extra steps to get away from the snake and then she set herself down. She's taken her shoes off and wrapped her leg. We've just added dressing over the top.
Sure.
Ree's extensive paramedic training and quick thinking may well have saved her life, but she's still in danger.
How do you feel right now?
Real fuzzy and lightheaded.
Fuzzy and lightheaded. Vomited just once so far?
Twice.
Twice.
Yeah.
Rhea has done an amazing job. She's had the presence of mind to stop, calm herself down, take control of the bite mark and provide first aid to it, but she's clearly feeling unwell right now.
Do you have a sheet or anything that we can do as a bit more shading for Rhea?
Yeah, we've got a blank.
It's been 2 hours since the paramedic was bitten. Matt has to make the call about how they're getting Ree out of the steep gully.
I look at the terrain that's around me and I look at where I am and I think to myself, how are we going to get out of here? And the best option that I can see at this stage is that we are going to need to winch the patient out.
Rhea, if we can get you out of here, give us your hand. Righto. Lie back. Now that arm through there. The helicopter will be overhead in a couple of minutes.
Okay, 1, 2, 3. The hoist is now on, mate.
Roger that. Set in the back, set for lift.
Copy, and coming up.
Roger. And mate's just coming through now. Tail is clear.
Copy, mate.
Sounds like they're up. Righto, so that is fully secure around you. You're not going to go anywhere now. The only thing is you'll get a bit of noise, obviously. You'll get blown down on your face. Yeah. I'll be right next to you the whole time.
I do my final checks. I've ensured that Rhea is okay and I've given the thumbs up for their helicopter to come. At that point, the crewmen start to make the approach and they can guide the helicopter into where we are.
And target is 3 o'clock, 800.
And visual, mate.
Roger.
So that's secure, that's secure. Go up, chest strap. You're okay. Goggles over your face. You're good to go.
Okay.
And we are committed, mate.
Roger, committed. Line is good, speed is good.
Perfect, mate. I'm not sure we're going to get much lower than this.
It's a bit bumpy, isn't it?
Yep.
When you are standing and waiting for the helicopter to come to you, it is an amazing view. You have this big machine that's hovering overhead. There's dust, there's wind, there's debris that comes towards you. There's a lot of emotion that comes in with that helicopter arriving.
Move right online. We've got 20 to run.
The patient is unsure of what it's going to feel like. What happens if something happens? There'd be 1,000 things going through their head, and I can't comprehend how anxious and nervous Rhea must be feeling.
5 to run. 4, 3, 2, 1. Just winching the hook out. Crewman has the hook and he's just securing the patient. Flight driver is to maintain your tail is well clear. Clear around. And still hooking up the survivor. And I have a single pump. Winching in the slag. Winching in the slag. And taking the load.
Okay.
Clear to winch. Clear to winch. Roger that. Load is coming clear of the ground. And winching in.
Rhea shuts her eyes, and I guess for her, that's like when you're going on a roller coaster and you're about to go over the edge, you realise this is happening, I've got no control of it now, I've got to close my eyes and just put my trust in the person looking after me.
Just near the aircraft now, just stabilising alongside. You are clear to climb. Slowly. Crewman and survivor at the door. Bring from the survivor input.
This is not a graceful procedure at all. There's a lot of shoving, there's a lot of pushing, and the crewman pushes me and I'm pushing Rhea.
Just got her on the stretcher.
But the last thing we want is for the patient to start to panic and move towards the door of the helicopter. We need to make sure everybody is safe.
We are secure in the back, mate. Good to go.
Copy, mate.
Do you feel sick? A little bit? And pain-wise now?
It's like a burning.
In your leg?
Yep.
Okay.
And a bit of a headache.
A bit of a headache. And nausea?
Yeah.
Might just draw up some more fentanyl for you.
Rhea has pain in her leg where she has been bitten. My concerns at this stage are, how is she going to go from here? Is she going to get worse? Is there going to be more venom that is released throughout her body and she will develop further symptoms? I don't know at this stage.
For Rhea, the significance of what's happened today is starting to sink in.
Bloody hell. This is not how the day was supposed to go.
No. You see the snake, obviously?
A big, dirty...
Bastard.
Was it a big one, was it?
Yeah. See how I missed him?
Yeah.
Most paramedics are very resilient and very strong. And Rhea's clearly displaying that. She's tolerating this like a real trooper, so she's done extremely well.
That plane's starting to creep up again.
Is it?
Yeah.
With the Royal Melbourne Hospital now in sight, emergency doctors are on standby to administer the snake antivenom.
And committed, mate. Roger. And coming down, mate. Roger.
So although Rhea is clinically stable, the next 12 to 24 hours are the critical time for her.
Yeah, happy to come out, mate.
She can still deteriorate to becoming very unwell.
All right, let's get you in there.
Just watching the hook out.
31-year-old Rhea was winched out of a treacherous gully after being bitten on the leg by a deadly brown snake.
Drink from his library book.
The paramedic spent 2 nights in hospital. To be certain, doctors gave her both brown and tiger snake antivenom.
So that should neutralise any of the toxin that's been absorbed into the bloodstream.
The serum worked, and Ree is back on the job. While she's still suffering from nausea and headaches, the paramedic is grateful for the lifesavers who came to her rescue.
I've got the most amazing colleagues in the world. I've got so much respect and I'm so thankful for everything they did that day. My message for anyone that is like me and can't sit still and wants to go out adventuring, do it, but make sure you're prepared. Have a fully charged phone. Learn how to use your GPS coordinates and do your basic first aid, because it will save your life one day.